question, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. Speaker, my question is to the Minister of Health. There's a difference between theory and practice. Last week, Dr. Paul Remoliotis, Eastern Ontario Medical Officer of Health, complained to the media, and I quote, "I'm getting too much criticism from doctors and experts in infectious diseases, epidemiology, immunology, and intensive care. Real doctors, those who treat patients, disagree with this dangerous theoretical experiment you and your overpaid public health doctors are practicing. Tens of thousands of doctors in Ontario and around the world are using science, facts, and their first-hand experience to challenge the lockdown narrative from public health. Minister, you can delegate authority, but in a democracy you cannot abdicate responsibility. When will you acknowledge, like all those doctors, that your lockdown experiments are doing far more harm than they are good?
Minister of Health.
Thank you, Speaker, and thank you for the question. But we have, from the very beginning, indicated that any decisions that are made with respect to COVID-19 are going to be based on science and facts, as you refer to it, and that's what we're using, clinical evidence. What is going to respond to this epidemic? How are we going to keep the people of Ontario safe? And that's what we've done every step along the way. Now, there are many doctors out there. There's other public health doctors. Not everyone is going to be of the same opinion. However, we have a very competent Chief Medical Officer of Health in Dr. Williams, very competent people at Public Health Ontario, and around the Public Health Measures table. Those are the people who provide us with recommendations based on the facts, based on the science, what's going to keep the people of Ontario safe, and that's the advice that we've been taking throughout this entire pandemic.
And the supplementary question.
Again, to the Minister of Health, you stated that you're using clinical evidence, but that's not quite true, is it? You're using bureaucratic opinion.
Please withdraw the unparliamentary comment.
Yeah.
Place your question.
It's not just practicing doctors and specialists that see your approach is causing damage and injury. Ontario and Manitoba's former public health officers, Dr. Richard Shabazz and Dr. Joel Kettner, are opposed to these dangerous lockdowns as well. Real doctors who treat patients and specialists and oppose this as well, but you don't listen. You don't even listen to the caucus and other.
Make your comments through the chair.
You only listen to Dr. David Williams.
Make your comments through the chair. Or I'll cut.
When will you start to listen and stop the suffering?
I'll remind all members to make their comments through the chair. Minister of Health to reply.
Well, I would invite the member, through you, Speaker, to consider what would have happened if we didn't do anything in Ontario. We could very well be in the same situation that Europe is in right now. Hundreds and hundreds of thousands of cases with their emergency departments, with their hospitals being overwhelmed. We had to take some action. We know these measures will work. We're seeing the numbers starting to go down, not to the level that any of us would like to see, but they are maintaining at a plateau. I would like to see them go lower, as would you. But we don't have...
I apologize to the Minister of Health. Member for Lanark, Frontenac, Kingston will come to order. Minister of Health can reply.
Speaker. We are relying on the evidence of frontline doctors because there's Dr. Williams, there's the Public Health Measures table, but there are many doctors behind that give them their response as well. It's not just one or two doctors. We are consulting with many doctors across the province.
Thank you.